EKG changes with electrolyte imbalance and thyroid disease. Let's go. We'll start with the easy one. Hyperkalemia. Hyper-K starts with a peak T wave, and as it progresses, it widens the QRS complex, prolongs the PR interval, and flattens the P wave. And as it continues, you'll end up with something called a sine wave. Essentially what it looks like is that you're grabbing both ends of your cardiac cycle and you just stretching it wide. Here is an example of the peak T waves and flattened P waves in the case of hyperkalemia. And here is an example of what is known as the sine wave. Hypokalemia first widens the T wave, and then your T waves get inverted, and as they come up, they attach themselves to a U wave. This also prolongs the QT interval because of that widened T wave. Here we have an example of an EKG with hypokalemia. As you can see, there is an inverted T wave here, coming up, attaching to a U wave, and then we have a P wave for the next QRS complex. Calcium is responsible for the plateau phase, or phase 2 of the cardiac cell action potential. That's when the myocardium has contracted and is holding that contraction. Kind of like if you were wringing a really wet towel to get all the water out of it. And this is represented on the EKG by the ST segment. Hypercalcemia shortens the ST segment and squeezes the T wave right next to the QRS complex, as you can see here. Now, hypocalcemia prolongs the ST segment and as a result prolongs the QT interval. However, it does not do that by widening the T wave, so you will end up with a normal looking T wave. Here is an example of a patient with hypercalcemia. As you can see, the T wave is attached right to the QRS complex. Almost no ST segment whatsoever. And here is a patient with hypocalcemia. Note this really long ST segment, but a normal looking T wave. Hypo and hyperthyroidism affect the metabolic rate as well as the cardiac muscle's contractility. Hyperthyroidism EKG changes are late and usually pretty unremarkable. You can expect to see sinus tachycardia or atrial fibrillation. However, we can pinpoint the signs of hypothyroidism on the EKG. In a patient with hypothyroidism, you can see little to no P waves, very low voltage or inverted T waves, global low voltage, as well as sinus bradycardia.